Welcome. I am Ayana Jones. I'm the ID Mentorship 365 Program Manager here at the IDSA Foundation. Thank you all for joining us today. Thank you for joining us for our webinar called Self-Care and Burnout Prevention for ID Physicians. This is in continuation of our ID Mentorship 365 webinar series. And special thanks to our speakers, who I will introduce here shortly. Before I turn over the program to our moderator, I have a few housekeeping matters. Excuse me. This webinar is being recorded and will be available, on demand. If you can't stay for the entire presentation, that's totally fine. The presentation will be uploaded to the Cooper lessons if you are a part of the mentorship program, or you can access it and share it via our IDSA Foundation YouTube channel. So we'll share the link to that. You'll notice right now that your boxes are up. You can show your camera. You can turn on your camera, but you're currently muted. Please feel free to use the Q&A feature to ask questions during the time that the speakers present. There will be a dedicated Q&A session at the end of the presentations where you can unmute yourselves and participate in the discussion. We actually encourage that. But in the meantime, we encourage you to use the Q&A function, and feel free to turn on your cameras and show your faces if you like. If we can't get to all the questions during the live event, we will do our best to address them in a follow-up email. So don't worry if you've submitted questions via the registration form, or if you have a question in the Q&A box and the speakers couldn't get to them, we will definitely make sure that we follow up with you. As a reminder, today, and in celebration of the Mental Health Awareness Month, our speakers will discuss coping strategies for traumatic experiences, combating mental health stigma, and achieving work-life balance, practicing mindfulness, and cultivating support networks. Our guests will share insights on physician and student burnout, and offer actionable techniques for enhancing well-being and burnout prevention. So you all have joined a really great webinar today. It's going to be a very robust discussion. So we're happy to have you all here. And finally, as you know, we're on social media at IDSA Foundation across all platforms. Please feel free to post or share your takeaways from today's webinar. I know it's been a minute. I don't know if folks really use tagging to kind of like live broadcasts or sharing takeaways from webinars in real time. But if you do, feel free to tag us using our hashtag IDM365. And you can also include us at IDSA Foundation. Now, I would like to introduce our host and moderator for today, IDSA's Mentorship and Recruitment Subcommittee Chair, Dr. Todd Vento. Dr. Vento is a retired Army medical officer with extensive operational and leadership experience, providing ID and public health expertise and operational leadership in support of military and civilian and humanitarian programs on 5 continents. He is an adjunct associate professor at the University of Utah and has extensive national and international committee and work group experience, hence him being the chair of our subcommittee here at IDSA. I'm so excited to have him moderating today's discussion, Dr. Todd Vento.
All right, thank you, Ayana. Since I didn't see any like pulling out hair, I'm thinking I'm unmuted. I really am excited today because we have, I think, such an important topic, and I would bet maybe beverage of choice or a little bit of money or whatever, if I were a betting man, that not a single person who's joined in doesn't have some story of their own or colleagues or others to share about this topic in terms of burnout, especially as healthcare providers, and especially in the last several years. And I would even venture to say that maybe that was something that was happening even earlier, and we weren't always paying attention to it. And this is, I hate to say that phrase about COVID and the pandemic, and given all the morbidity and mortality, but possible silver lining is that it raised our awareness to things that we should be doing all the time. Not just about, things like health inequities, but, taking care of ourselves as healthcare providers so we can continue to do this job, profession, calling that we really love to do. So I'm going to keep it short to try to get to our experts and celebrities. And I will say that I'm really happy that this is a Paisano Italiano panel, because we have already Ayana Jonas, and we have Julie Trivedi, and we have Priya Nori. So, and then you have Vento. So I'm really excited about that too. But I think we can go to the next slide, or I hope. Okay, so I'm going to introduce both of them first, and then we're going to turn it over so we can get started. One thing I did want to mention, Ayana mentioned that this was Mental Health Awareness Month, and what this is a really informal chance to have discussion. And so we really, like to see people. I think we get to already send a virtual piece of candy award to somebody I saw was on, but now they're off. But so if you turn on your video, you will get some sort of virtual candy reward, apparently. But this is what this open discussion and sharing, so you can sort of build our knowledge base, and then an opportunity to openly discuss. And so we'll do some questions, Q&A, but we really want folks to be involved. And Mark Shelley, by the way, first junior mint. So what it isn't, though, is not a professional mental health visit, group care visit. There's no RVUs or anything like that. And our experts are not behavioral health practitioners, but certainly if that's something that you are looking for on this, we can certainly direct you to that. And there's a lot of resources we have at the end and also online. So let's start off with Julie. So Julie Trivedi is actually out of UT Southwestern. She actually does a lot of leadership work, both with IDSA, even when she's not on a committee or work group. Sometimes she gets like pulled into that because of her energy, enthusiasm, and spontaneity, which I think we've already tortured with a few times, and we're very grateful for that. But she also has a formal role, I think, on the education committee for SHEA, or the Society for Healthcare Epidemiology, and holds obviously an associate professor of medicine position at UT Southwestern. And I'll leave it at that. We could go on. But Julie, so glad that you're here, and really appreciate your energy and willingness to share on this topic. So Priya Nori is also a leader within Infectious Disease Society and other national programs, but also is out of Albert Einstein College of Medicine and oversees antimicrobial stewardship and OPEP programs. And I believe also is the program director for the Infectious Diseases Fellowship. So if that's something you are inclined towards, you might want to remember her name. It's an Italian name, so you can't forget it. Okay, with that, I believe I hit all the highlights, and I want to turn it over to have the experts start sharing. And everyone, turn on your camera so we can see and have a very casual, open discussion. And don't hesitate to put in any questions that you have that we can address at the end as well. Okay, all yours, Julie and Priya.
Thanks, Todd. So we are so excited to be able to be here with all of you. We realize that this topic is huge, and we cannot possibly cover everything in the span of 30 to 45 minutes. Most of us are already familiar with the topic of burnout, so we really wanted to be able to get down into the meat of everything and start talking about either sharing our own personal experiences, and then obviously hearing from all of you to see the questions that you have, and what we can do to help make things better.
Yeah. So with that, I think the best thing to do is just to launch our polls, because these will help us understand the audience and the challenges of our audience. So can our friends at IDSA help launch? Yes, very good. Okay, so the first question is, what is your experience level? Med student, resident, junior attending, mid-career, or senior? Okay. So why don't we end that poll? And it looks like we have a good mix of folks everywhere, anyone from medical student down to senior attending. So very nice. So I think we have a lot to learn from each other here. Let's go to the next one. Okay. Have you or a close colleague ever experienced any trauma, physical, mental, or emotional in the workplace? Okay, so this is very telling here already. It looks like the majority of folks have experienced trauma, and a small percentage are not sure, meaning that maybe if it were defined for them, they may be in the yes category, perhaps. And we have some comments coming in, which we will get to. Okay, can we see the third? Okay, have you or a close colleague, sorry, I thought this was the last one, ever experienced burnout? Okay, so I mean, I think we can close this one early because 100% of you have said yes. So we'll get into that. We'll get into trauma a little bit as well, and hopefully how those two things are actually closely related. And then now the fourth question. Okay, what was that burnout attributed to? All right.
I know you're going to talk about those results, but what's fascinating so far is that out of everybody who responded, nobody has said that teaching or mentoring was actually any part of the contribution to burnout, which just is pretty telling about, why we do what we do.
Very cool observation, Julie. That's great. So I think we'll circle back to that in the kind of take home practical solutions. Maybe we could talk about how to maximize the things that we love. Let's keep going. Okay. Do you think burnout has ever negatively impacted your performance at work or at home? Okay. So yes, so everyone basically answered yes. So we'll hopefully hear from you a little bit later on as to what aspects of your life you feel are most impacted by this and what we can do about that. And I think maybe there's one or two more questions. Okay, so do you think your gender identity, race or ethnicity, or cultural identity impacts how you experience burnout? Okay, interesting spread here, Julie. What do you think?
Yeah, it looks like a lot of folks aren't sure. And I think that's really interesting as well, just to see how all of these things factor into who we are and how we show up in different places.
Yeah, and maybe how we may be more vulnerable to burnout in certain ways, but then how we may lean on those things as well. And then I think the last question is closely related, so maybe we will fire that one up. Okay, so do you lean into your gender identity, race, ethnicity, or cultural identity to help mitigate your burnout? Okay, so this was my personal favorite question. I think I have a lot to say about this, but we'll get to that, and maybe we can learn from each other a little bit on how to use these things as our superpower and maybe to help mitigate some of the negative aspects of our work. Okay, so those are our poll questions. So now we're just going to get right into it. Julie, you want to kick things off?
Yeah, definitely. So let's just start talking about burnout. There's, I think, common definitions, colloquial definitions that we all use when we're feeling stressed. But then there's actually also formal WHO definition of burnout constituting emotional exhaustion, cynicism in the workplace, and then also this sense of not feeling like you are doing your job correctly or performing as you should be. And so, Priya, have you experienced any of those?
I have, Julie. I think like everyone, a lot of ID folks, we cannot really talk about the pandemic, as Dr. Vento said, without talking about burnout at certain points. And the thing that made it so difficult was it was so drawn out, and we really didn't have an end in sight at a certain point. I know we had spoken a lot during that time. I think a lot of folks in the work that we do, which is IPC and stewardship, we certainly felt that crunch, but all of our ID colleagues, I think. So that is the most recent memory for me in terms of burnout. What about you?
Yes, and I kind of joke around that I'm like on cycle 4 of burnout. So I've experienced it probably through multiple stages of my medical training, even in medical school. I know after residency, certainly in the past several years. And I think the way for me it's really shown up is just being a little bit out of character, being more irritable, more stressed, maybe snapping either at family or at patients or coworkers. And so kind of behavior that just is not really how you normally would be. And you can start to see the impact of that. And I think that, of course, the past several years really did a lot for us. But I think part of the thing that I also think contributed was not feeling valued, or how we were received in this field of infectious diseases. And I think that, oftentimes we can mitigate maybe the stress that we have when we realize that we are making active contributions and people are valuing and appreciating that. And so when that part of it is not coming in, sometimes it can be harder to continue to find that motivation and engagement in what we're doing.
Yes, Julie, you're so right. I have come to think about burnout in the human factors and the non-human factors. And this applies to all kinds of stressful situations and, in fact, trauma, I think, anything negative that impacts our mental health. So the non-human aspects of the things like the pandemic were just lots of patients, they were very sick. We didn't know the disease. We didn't know a lot about it. We didn't have treatments for a while. We didn't have vaccines for a while. And there was just a huge learning curve. But you know what? In infectious diseases, to some extent, we accept those challenges and we rise to the occasion, and we almost always rise to the occasion. So those are the non-human factors. But actually, to me, and it sounds like to you as well, and we've had these conversations, the things that burnt us out more were the human factors, were like behaviors of individuals, especially those who may have had a certain degree of executive decision making, who would take or not take our recommendations, and either they would be disseminated for the health and safety of everyone or just go into a vacuum. And these were the man-made factors that I think in a lot of ways were unnecessary, didn't have to happen if we just were, took a breather from time to time. And these are the things we should seek to try to avoid happening going forward, because I think those are the things that are squarely in our control. We can control what we can control, and that breaking it down into those low-hanging fruit, using stewardship language, really does help us to overcome some of the burnout that we experience. We can't overcome the disease per se, but we can overcome the human BS, so to speak, to some extent.
And I think it ties into just how we feel in the general field of infectious diseases, trying to advocate for more equitable pay, trying to be able to demonstrate our role and importance in many different areas of the hospitals that we work in or health systems. We know the studies there about improved outcomes and reduced mortality and reduced readmissions. And yet sometimes it seems like those benefits are not necessarily translated into we really value you and place you here in this important place. And so I think that the field of infectious diseases certainly has been experiencing that as well. And even when we think about funding, let's say for, many of our patients who are, being treated for HIV and other like STDs, that funding has really dropped significantly in those past several years.
So Julie, what you're saying reminds me of a term I learned during the pandemic. I had no vocabulary for something like this before, but I believe what you're describing is moral injury, basically, right? Where people are undervalued and they feel that exceedingly what they're doing doesn't matter anymore, despite it being such a heroic calling. I know you spent a lot of time thinking about that. Can you share any moments where you felt morally injured, and how does that play into this whole topic of burnout?
Yeah, I think probably some of the main areas were kind of like what you said, making recommendations, let's say during the pandemic as the medical director of infection prevention, and then those recommendations just being put to the side. And then sometimes even things getting to the point where you're not even being asked anymore. And the decisions, let's say about pre-surgical testing and masking in institutions, are being made even without your input. And so, you start to feel like, I know I'm important, and not in a self-inflated ego way, but I know I'm important. I know what I do is important. I know I have expertise. And I know that what I have to offer is valuable and going to benefit our patients. And yet the response is still not what you're hoping for. And honestly, I think that something that was really helpful for me, and this is, was I know that, I had so many interactions with so many different people in the hospital and the health system. And when they would actually thank me personally for having spent that time talking to them on the phone, helping them navigate their father-in-law's diagnosis or something, or, they're symptomatic and what should they do? And I think to me, that was enough validation, that what I had to offer was something valuable, even if it didn't come verbally from other areas.
Yes, absolutely. I'd like to know, maybe by thumbs up sign or something in the chat, have our audience members experienced what Julie described, which is this moral injury as part of your burnout? I would suspect yes. Maybe in the meantime, I can share a particular incident that I experienced around the same time, which is, yes, so people are chiming in, yes, which is what we expected. So I was scolded terribly by our vice president of clinical affairs, so, high-level executive in the hospital, because I was asked to speak about COVID therapeutics to our board of trustees. The board of trustees had created a COVID fund, and we were able to do, things that we needed because of their generosity. I understand that. And I did the talk, right? I put together the slides. I did, the same old way that we always do these presentations. And he didn't like that I wasn't taking it seriously enough. Because I was like, yes, I've done, a bajillion presentations on COVID at this point. Don't worry, like everything will be fine. We're okay here. But he transferred his fear of high level, very wealthy donor types onto me. And we didn't have the same goals. My goals were to convey the information, share what we were doing, status update, right? In the way that ID folks often do. But his goals were entirely different. And so because they didn't align, I was scolded for being a little bit too lax. And so everything ultimately went fine, and we're fine. Me and that individual are great. But that's what I was referring to as like the human BS that often makes tense situations even tenser. And I think with just seeing eye to eye, having a conversation with individuals, being open and honest, hopefully we can prevent some of those things in the future.
I think your story probably resonates with many people. And I wanted to kind of shift that into seeing the impact of, let's say the moral injury or burnout in general on mental health, especially in healthcare workers, physicians, students, trainees. We heard so many stories, especially in the beginning of COVID, of, let's say, an emergency room physician taking her life. And a lot of these types of stories coming out. And of course,
yeah,
right, it's not something new in medicine. It's not described. It's not a new thing, but it's something that we don't often talk about because it's seen as a weakness. So I wanted to share my own experiences. This is something that I actually have begun to more openly talk about. I think that, when I look back over my medical training, I probably was experiencing postpartum depression after my daughter was born and I was starting fellowship. Did I realize it? Nope. Did anybody else recognize it? Nope, because this was 2008 and we didn't talk about these things. We didn't talk about burnout and wellness and
have the tools and the language.
And capping the number of consults that you do when you're on service. Like there was none of that. And so I think that that was probably one of those first times. But in 2019, actually, which is just 5 years ago, probably towards the end of 2018, things had gotten to a point for me. I had moved to Dallas. I was in the middle of a relationship that was breaking apart after having been married for a long time, moved halfway across the country with 2 kids under the age of 10 to take on a new job in a state where I had no family, or in a city where I had no family. And I think for me at the end of 2018 is when everything just I just imploded, I just collapsed. And I remember my PCP having been telling me in the last couple of months prior to that, you're gonna need to start slowing down a little bit or take a day for yourself and start taking care of yourself because you can't sustain this. And I would tell her, well, if I take a day off, that's just more work I have to do on another day, So something we all struggle with. But, it was in January 3rd of 2019. I remember seeing her for a follow-up visit, and we knew that like I needed to be in the hospital. I had, I fell behind on clinic notes. Press-Ganey scores were starting to go down, and I had, stopped eating for several days. My division chief knew because a friend, another colleague, I happened to talk to her, and she knew. And really, what kept me going every day was, taking care of my kids. And it really raised this thing for me that if we're going to assess someone's state of mental health by whether they have a smile on their face and whether they show up to work, then we're not going to be able to help anybody and recognize anybody, because all of us are high functioning people, and we may not have, deficiencies in our behavior and performance and everything. And by the time that happens, we've probably been dealing with this for a long period of time. And so I talk about this because, therapy is important. I jokingly say that every woman by the age of 40 should have their own therapist. I think it helps to uncover things. And if I hadn't gone through all of that in 2019, I can't imagine the state I would have been in to lead our institution through a pandemic in 2020. So it was so important for me to be able to take that time and really address a lot of these beliefs and behaviors and thoughts that weren't serving me anymore, and really start to reprogram with what I need to be telling myself and doing to help me to have a healthier future and a happier one too. So I know I took a few minutes with that, but I just really wanted to share that. We all go through lots of things at different stages of our careers, right? And so I like to make sure that what I didn't get when I was a trainee, or what wasn't recognized in me when I was a student, I want to make sure that that doesn't happen to our current generation of students, trainees, even faculty, So I'll stop there.
Julie, thank you so much for sharing all that. We've known each other for a while, but I don't think I realized the extent of what you went through there. And so thank you for your honesty, and wow, how courageous for you to pick up and as a single mother, essentially, to start over and start their lives over. And I know they're thriving now, which is wonderful. So given your experience, what are some tips for us who might be in a position to supervise other people, whether they're medical students or, junior faculty? What are some of those signs that we should look out for to say, okay, well, this person has a very brave face and they're doing the job, but maybe something's not right underneath? What are some of those flags, you think?
I think that, we can always certainly see the impact on performance when someone, let's say they've been doing well and then they're falling behind in something. So but nobody would notice that if they don't know you. And so I think that really points to the importance of connection with our colleagues. The pandemic made everything so nearly impossible, right? Because we need to have that face-to-face time. And that when somebody asks how you're doing, we tend to say, I'm good. And then we move on. And it's really about when we do that then with our own colleagues, right? So we can start with us to say, no, like, how are you doing? And holding that space. And I think that that's the biggest thing that we can do, is to be able to hold that space for our colleagues, create that safe environment, knowing that, what you're sharing is not going to impact your review that you have every year with your division chief or your boss. And really is a way to then say, what do we need to do to get at the root of it? And like you mentioned, there's human factors, non-human factors. There's things about the system, and trying to give people the benefit of the doubt. So I think that when someone, let's say, is falling back in their performance, not assuming that it's because of lack of personal motivation. And, in the 5 dysfunctions of a team, there's that whole matrix of looking at personal motivation, personal ability, and then look at the impact of social and structural issues. So sometimes there are things that are socially happening with our colleagues or structurally that we don't have that control over, but are still impacting us. And so I think that when we automatically assume that it's because someone is not motivated, we've already closed that door on them wanting to open up and be able to share. And so we have to be willing to create that safe environment so that people actually feel safe enough to be able to express. Part of the way to do that is to start openly talking about it. And that's kind of the way I approach it. So there's some comments in the chat
Yes,
too.
yes, there's some great comments. So Mark Shelley recognizes his own warning signs as irritability and anger in terms of triggers for or signs of burnout. So I think that's great. Thank you for sharing that, Mark. Knowing what our own personal triggers are, or when we may need to take a breath and recognize that we're starting to get burned out and something needs to be done. I think that's hugely important. I think mine are also irritability or suspecting the wrong motivations in everyone or thinking the worst of everyone. I notice that happens to me. So I think we should all take a minute to think about what our individual signs are. There's also a comment earlier on you mentioned, Julie, the system issues. And so somebody named G, which is a pretty cool rap name, mentions specifics like day-to-day things that we all have to deal with all the time, such as consult notes, right? It'd be very helpful to have a list of points that will be required to include in a consult note, and then things that are a waste of time or not required. And so while that, those kind of particulars are a little bit outside of the scope of what we can talk about in this time frame, but I think those finding shortcuts for yourself, finding efficiencies, finding ways to mitigate some of the daily just low value junk that we all have to deal with as ID physicians. And these may be things like smart phrases, or they may be things like, certain shortcuts in the EMR. One really awesome tip I learned from somebody I work with at the ASHI Journal is batch your emails to the end of the day. You would be amazed how many things just get taken care of. People find a way. People will sort those things out without your needing to play that game of ping pong. And so batching them to the end of the day already reduces so much of the mental load that you will ultimately have to deal with. And if it's an emergency, that's not an email anyway. An emergency should be a phone call. If that person needs you so badly, they'll get on the phone and call you. But if you think about it, most junk in email is man-made and can be dealt with usually at the end of the day. So I think those are our two big comments here. Let me see if there's anything else. Ohio, only handle it once has been helpful for me. That's fantastic. Thank you for that tip, G. Yeah, you said your piece and then you walk away and let people sort it out. I think that's very helpful.
So we wanted to take a few minutes before we go into the Q&A to really maybe think about what are some of the self-care techniques that we can do. And we know that addressing burnout is not just the person problem. We know it's not just the person who's experiencing it, who's supposed to fix it. But that being said, I think that it's important we know how to recognize in ourselves and then be able to, put in some interventions. And so before we talk about some of the self-care, there's a book, we'll have a list of resources for all of you, but there's a book called Burnout, The Secret to Unlocking the Stress Cycle. It's by Emily Nagoski. And it talks about there's stresses and then there's stressors. So there's stress and then the stressor. So we may not be able to get rid of the stressor, but we can address the stress that is being caused by that stressor. So Priya, what are some things that you like to do that help you deal with stress?
Yeah, thank you for asking, Julie. So I'm certainly not an expert by any means, but what I am is a woman of a certain age who's lived and spent a lot of time with my girlfriends and people in my peer group, and have shared ideas and spoken about what works with each other. So I think number one is to have a really tight peer mentorship group. And it may just start off as a group chat or a couple of friends at a conference or at work or something, but you'd be amazed about how many things you share in common because of the shared professional experience or a shared cultural experience, or, just so many things. So I have a group of girlfriends that I met through a different organization, Shay, that Julie and I work with. And we all do similar work, right? We all do stewardship or infection prevention. And what started as a kind of professional asking of questions, hey, what's the deal with the AU module, things like that, then slowly became like, especially during the pandemic, a lot of, burnout stuff, a lot of like, hey, was I just gaslit? Can you believe this just happened? How do you think I should approach this conflict with this individual? And I've heard a lot of people say that, actually. Lots of very high level leaders I've spoken to in ID heavily rely on this peer mentor group. So I would say find yours, find your people, your tribe. And this is ID. Already we have so many potential members of your tribe here because we are all part of this larger tribe and family. The other thing, Julie, that I rely very embarrassingly heavily on, I think, is that especially as I get older and during the pandemic, I spent so much time with my family, who I'm very lucky all happens to be in New York, is I really culturally leaned in to a embarrassing degree. If you look at my Netflix algorithm, it's basically all Bollywood stuff. A lot of stuff that I wear culturally, a lot of my fashion, which I think, people that's like my second identity a little bit. So much of it is culturally based. I deliberately choose designers from my country of origin, which is India, the subcontinent. I wear that like as a badge. And I heard somebody once say that their gay Nigerian identity became their superpower. And so I was like, okay, that's really cool. And so I started looking at my own female identifying, South Asian person as kind of tried to unlock that as part of my superpower. So that's kind of what the two big things that I lean into. Julie,
That's really incredible. Yeah. So, and it sounds like you have to be very diligent also about establishing boundaries, because that's probably where I struggle the most. The need to always be available, whether that's to your kids, to your partner, to your job, whatever it might be. And so I'm probably not the best one to talk about like long sustaining self-care things that really help you. It's probably why I'm on cycle number 4 or something of burnout. But, these are things that are on my to-do list. I think that honoring yourself is probably one of the most important things. And there's different ways to do that. Some people like candles, bubble baths. Some people like spending time in nature. So there's a whole wide variety of things that you can do to help honor yourself. I think it's recognizing when you need rest. And I've been recently learning that there's like 7 different types of rest. There's physical rest, emotional rest, spiritual rest, mental rest. And I was like, this makes sense, because I would say I'm tired. And then my fiance would be like, well, why don't you take a nap? I'm like, I'm not sleepy, but I'm tired, right? Like the mental load that's there. So that's just, I've been really exploring a lot of this stuff here, these apps that are there, Headspace, Tapping Solution. I'm not consistent with any of them, probably need to work on that a little bit more. But yeah. Yeah.
Another really valuable lesson I learned from one of the leaders within IDSA is the importance of value. And having that conversation with yourself of what are the things I value and what are the things I absolutely don't value. So it was almost like that conversation you had with yourself in the 3rd year of medical school, where it's like, am I going to be a surgeon? Am I going to be a pediatrician? Am I going to be an ER doc? What rotations did I absolutely love? What spoke to the inner me, and what did I hate? And so that shouldn't end there. That should kind of be happening on an iterative basis almost every day, and certainly at least a couple of times a year. In the same way that we say, okay, I really value teaching and spending time with mentees and trainees. That was the thing I think we can all decide is one of the best parts of what we do. And hence this program is within the mentorship framework of IDSA. And so finding ways to maximize your time spent in those areas that bring you inherent joy and value, and then figuring out what is absolutely something you want to run away from, and speaking with your supervisor trying to minimize the time spent there. I think doing that calculus is helpful.
I would agree completely. So I think, we'd like to maybe turn it over to Todd to see if there's any questions that are there from the audience, or if any of you want to come on camera, unmute yourselves, ask a question.
Yeah, while folks are typing or thinking about what they want to ask, and we really do want folks to feel comfortable, we also know that people may not feel comfortable in asking, but if you put it in the chat and just wanted to address, we certainly won't call you out or anything like that. This is the non-attributional environment. But I just do want to say, and we'll say some more at the end, but that I think the fact that you see two professionals, like very accomplished, even national scale type professionals who are willing to be human beings and be transparent, open, and vulnerable, and nothing happened to them. They didn't get, nothing fell out of the sky or anything. Why? Because they were authentic and they shared exactly from their personal experience and their lives and their hearts. And in the end, that is also what made them probably even be better at coping with those things, because then it's not like, well, I can't do this and I can't do that. Like, no, just be you. And that's what will get you through. And I think that's a hard thing. That's not been a thing that's been talked about in medicine. It certainly wasn't when I was in training, when it was like, morning report was, okay, so you tried to kill these patients last night. What else did you do? And literally, that was the pre-work hours, all that. But point is this to me is so helpful. And I just did want to say, in case we get close to the end, without being to wrap up, that this was really just incredible. And I don't think that is something we talk about a lot nowadays, but do people live it and do it? And I'll tell you, Julie and Priya just did it. So that I'm just really grateful for that. So hopefully my song and dance comments there, which were real and sincere, gave some people some time to put some stuff in the chat.
And I think, Todd, while you're looking for questions, I was just going to add, that this is always an ongoing iterative process of thinking about what brings you joy, what doesn't bring you joy. And maybe the things that you enjoyed doing 10 years ago in your practice might not be things that you enjoy doing anymore. And sometimes it's like we know inside what we need to be doing and not doing, but we fear uncertainty or the unknown, and we're hesitant to maybe give up that administrative effort that makes it, so that you don't have to spend all that time on clinical service. And I think this is actually something that's been going on for me too in these last few days. So I just stepped down from my role as medical director of infection prevention at UT Southwestern. It wasn't a completely voluntary thing, but I think given the nature and the dynamics, it was probably something that was better for me. And I felt this sense of relief inside, that yes, I was sad and I was angry and I was, all of those human emotions, but deep down inside, I knew that that was the right step for me. Do I have it all figured out for the next fiscal year? Nope. Thinking about what I'm doing, but it's allowed me to then put some of my efforts towards and energy towards coaching, which is something that I also do. I'm a certified coach. I'm creating the coaching program for rising leaders in IDSA, something that we're trying this year. So I think it's finding your thing. You don't always have to leave medicine to find your thing, but even within medicine, finding what brings you joy is so important.
Thank you, Julie. Priya, you put something up there. I'm going to have you talk that, but either of you, if you wouldn't mind, maybe addressing or coming up, share your thoughts on Amari's question or question about what immediate steps can be taken when someone, oh, I recognize it, I'm burning out. What things do you say? Well, and obviously there's probably no right answer and might be different for each individual, but if you want to comment on that, that would be really helpful.
Todd, so the question is,
what
outside the mentorship program might be
so it's just a
type of support.
Oh, sorry.
Absolutely. Yeah, sure. So I think, a lot of peer mentor groups start very organically and very low key outside of any formal structure. Honestly, it's like a group chat. I recently had the pleasure of speaking for the ASHI Journal to two major IDSA leaders. I know you've all heard of them, Jam, Jacinda Abdul Mutakabir, and Mati. And they basically said it all started with a group chat. And they are a very prominent group of women, minoritized women, ID leaders who helped each other on their rise to leadership and provided each other with positive affirmations and helped them see when they were being, either gaslit or microaggressed upon, or just, so many daily things that happen to us, to us all, really. And so basically it all just started with a group chat. And so I would say find one or two people that you really click with, that you have a lot of intersections, that you are interested in similar things, either within work or outside of work. And it kind of just starts there. It starts with coffee at ID Week, and, it can all take off from there. And it doesn't have to be any kind of formal commitment or expectations, but it can be, like a group Zoom every once in a while after hours. It can be something totally unprofessional, like a watch party or a book club, or like, we're all going to take this, a few of my friends, not me, because this is not me. A lot of my idea friends do Peloton rides together. I wish I was that cool and fit, but I'm not. So I'll leave that to them. But there's just like so many small little ways to intersect with people and then grow these relationships from there.
Thanks for sharing that, Priya. And that's something that probably would develop, I think, on the order of short to intermediate term. And if there's, just to really get at that question that Amari asked either of you on, you're right here, you're right now, this present moment in time, and you realize I am actually on the verge of burnout.
Yeah.
Steps right then that you would say, oh, I better do this, or this will work for me, or what did you guys? What's your thoughts on that?
I would say the first thing that you need to do is probably take the day off. Okay. If you realize that you're on the verge of burnout, that means that you're just at the tip of the iceberg of all of the things that you're going to need to do to kind of rework your life and who you are and what you do and how you spend your energy to make it so that it's working for you. Incorporating mental health days, trying to find out, what are the things that you're responsible for, let's say in the work environment, that you're able to delegate or hand off to someone else. And that is something that maybe your division chief or a colleague might be able to help you with, right? Everyone's always looking for opportunities to get involved in something. So those could be ways to do it too. And then I think another big thing is about establishing those boundaries and saying, like, what is important to me in my life? If it is really important for me to have dinner with my family every day at 6 o'clock, then that has to become a non-negotiable for you, right? So you have to think about, what are the non-negotiables? If it's to take your kids to school every morning at 7:30, and that's your non-negotiable, then, if there are meetings that are going to be held at 7 and 7:30, you need to speak up and push back. So I think that, how it's received it's not always in our control, but I think we have to be able to feel stronger about advocating for what we need. And that starts with a lot of self-awareness, self-reflection. What's working for me? What's not working for me? What can I get rid of? What do I want more of? Coaches can help people work through that too, and re-identify their purpose, right? Like, people have become disconnected with their why, and we talk about, we know Gonzalo loves this, and Priya, like, what is your why? Simon Sinek does a TED talk on this. And so when you re-identify yourself and reconnect yourself with your why, of why you went into medicine, why you're doing what you're doing, and you begin to do more of that, then it starts to make the other stuff not as painful. And also, maybe things that you realize, like, this is dragging me down. Like, when I thought about my issues that were going on with the infection prevention, it's like there would be the sense of dread inside of, like, do I have the energy mentally to deal with this today?
That's when you know that you have to walk away, right? If something is associated with just sheer dread, you don't want to get out of bed and go do that thing, it's definitely time to walk away. It's not heroism by continuing to do that and show up for that. You're not doing anybody any favors.
And take your vacations, take your vacation time, use that up every single year, personal mental health days or sick days,
Julie, I so agree with you. I just want to add that, and like, this is a little bit maybe cynical of me to say, but those C-suite people are taking their vacations, okay? They are definitely they will structure their lives around the things that they like to do versus the things that they need to do. And so rather than pointing fingers and saying, oh, that's because they don't care, they don't work hard, they're only in it for the money, I think we can learn from that, actually. I think we can learn from how really successful, high-functioning people structure their lives and always do the things that are most important to them, because their philosophy generally is, well, if I take good care of myself, then I can show up maximally at work for my organization, for my family, etc. And so we didn't really talk much about the self-care thing at all, but I do think that taking like even a half an hour, heck, an hour for yourself every day doesn't hurt anybody. In fact, you'll have more energy to come to clinic as your best self. You'll have more compassion for your patients. You'll have more just like mental energy to deal with some of the man-made problems at work. Your mind will be clear. You'll just be a better version of yourself by taking just that small amount of time to do the thing that you like the most. And this can be going to the gym. This can be meditating. This can be
Or
taking your
getting on the
dog.
Peloton there.
Getting on, oh, shush, Todd. You know how I feel about Peloton. No, just kidding.
Silly. No, I really, sorry, go ahead.
Whatever is that thing that brings you the most kind of mental de-stressing, in that for a lot of people, I think that is maybe going to the gym or something physical, because it has so many benefits.
Yeah, fantastic. And one thing I would say, I want to get to one question, because it's actually a question I think for some of our folks in the audience, at different stages of their career, or starting their career, or trying to think which direction they do want to go, that this comes up a lot. And I think some of us who have been doing medicine for a long time don't even think about this. And Amari brought it up. But I did want to say there's a couple of things I want to point out that what Julie and Priya mentioned. So this first thought is that you have to stop. Somebody's got to hit the pause button when you're about to go over the edge, as someone said, like rolling into burnout. And that is something that you could also tell by the wording that they use, that, and they weren't saying it necessarily for what they didn't do. It was more like doing it for yourself, knowing that others might not realize or recognize that that is important. And because of the culture that we've lived in medicine, where, like, what did you do? You went out of the hospital for lunch? What, why did you do that? There's so much going on. Like, well, that's the whole point, is that also, I would say, and this is the harder part, is that, and you don't have to do this in an unprofessional way, but I still see it occurring, is that people will still think that that was something wrong. And those things can be also addressed very calmly, and say, I did this because I need this. And if you have concerns about that, and I'm not trying to say all these little things that you might have to do, but there is still, by leaders like walking the walk and doing their best to show that we believe in this, we don't just say this, that then you can believe in that, and then you can do it, and people will also model that behavior. But the part that I think was important, at least for me, was you got to stop the bleeding first, right? You put pressure, and then you readdress. So we have a few minutes left, and this always happens.
I was going to add one thing to that. So I was going to add one thing before Ayana and Amari wrap it up. I know we like to have maybe an action item. So this is my action item for all of you, is to take 30 minutes, 40 minutes, or an hour on Sunday, look at your schedule for the week. And what I want you to do is, when you create your schedule, slot out the times for wellness and family, or, if those are the two important things to you first, and then see what it would look like to arrange everything else around that. And so that is, I think, a great step that you can take to reprioritize your priorities.
And I would say that I am not good at that, and I will block those things first off, even though they're scheduled, and you can't do that. And that gets back to Priya's comment about, if you don't think that the C-suite executives who are walking the walk haven't scheduled that vacation, and there is like their executive admin who's like, oh no, that is like, do not touch. And you have to. And then you also make your schedule and schedule every single thing, even if it's scheduled like, I'm doing meditation for 30 minutes. You have to schedule that sometimes to then you're, look, no, I'm meditating now. I'm not taking an extra call from the clinic or whatever. So I do want to transition. We only got minutes here. Ayanna, let me know. Can we answer this question? It's a little bit loaded, but about how can we deal with death every day without losing our mind and our empathy the same? Can we get 2 comments from maybe our expert panel before we wrap up?
Sure.
Yes,
How do we
that's a
deal
yes.
with
Go
death
ahead.
every day? Yeah.
Yeah.
So, there's a lot that happens when you lose a patient or, you're with the family member. I think in medicine, we've become really good at compartmentalizing and sometimes too good at compartmentalizing, where then we lose touch with our own emotions. What I try to encourage the students, trainees, is to, even just be there and hold space, let's say for the family members, but then take that time to process it for yourself as well. We don't want to pile these things up, sweep it under the rug, and then you realize you've become desensitized to it. And when somebody passes, you're like, oh, it's just another patient, and you move on to the next one. But really taking that time, let's say later on at the end of the day, to reflect on that, reflect on the ways you contributed towards the care of this patient, and maybe even identifying what it is that they meant to you. And sometimes when the family's still in the room, and if there's the chaplain or someone there, even offering your own condolences to the family members, showing that you care, helps to keep you in touch with your human side, and it helps the patients and their family see that human side of you as well. And I think we often lose connection with that.
Do you have any comments? Or we're
No, I just put it in the chat.
Okay.
I'll
okay. Thank you. All right. Well, I'm going to go ahead and turn it over to Ayanna to give us any housekeeping items to wrap up on. I will say, and I want to steal her thunder, that we will have the questions that were submitted. We have a mechanism to get answers to them, and those will be forthcoming, and we can provide you the email explanation or instructions on how that will happen. And I did want to say very quickly that I am so grateful for what Priya and Julie just did for us, and what they shared really from their true selves, what they've been through and what works, and then some great tips. And I and so Julie and Priya, thank you so much. I'm very grateful. The last thing I want to say is recognizing a former colleague who has a brilliant sense of humor that actually joined the program and just submitted his retirement papers from the United States Air Force. He's currently the medicine consultant to the Air Force. Brian White was across from me when I was mid-career staff and he was young staff. And I can't think of how many times I went to the hall and I go, you know what ortho just called me on? And somehow just having that opportunity to ventilate for 1 second and someone let you do that and provide that, even if there's no words, just being there to receive that was so important. So thank you, Brian. But that also gets back to, I like Julie's comment. If you're not loving what you do, then you have to change what you're doing and maybe even consider changing your environment. If you don't have some Brian Whites in your immediate circle, in your professional tribe, you need to get some Brian Whites. That was my Brian White fan club. All right, Ayanna, do you have any comments for us?
Yes, thank you all. This was such a good discussion. Round of applause for our speakers, and Dr. Todd Vento for moderating such an awesome discussion. It looks like Dr. Priya Trivedi, Dr. Julie and Dr. Priya put their contact information in the chat box. So you all have, if you have immediate questions, you can just reach out to them directly. So yeah, thank you again for today's robust discussion. We are, if you like to revisit our old webinars from this series, this is the link here to our YouTube channel. I saw that someone mentioned, what is Cooper? Cooper is a part of the ID Mentorship 365 program, which will be launching the applications for our 2024 cohort in June. So if you haven't been a part of this year's program, which birthed this webinar series, you have the opportunity to apply and be a part of next year's program, serving as a mentor or mentee. So we'll be making announcements around application dates coming soon. And then the last thing is our next webinar is going to be on thriving in academia. We have the date will be announced, but we do have the registration link. This is a tentative date. We'll confirm the date with you all. If you'd like to click on the link and just register, we'll follow up with you and just confirm the dates and the speakers for that. We have another mentorship, IDSA mentorship and recruitment subcommittee member who will be moderating that discussion. So finally, post about us, about our past and upcoming webinars on all of our social media channels, and take a moment to just connect with us there. So thank you all again for attending. If you have questions, reach out to me or the speakers, and enjoy the rest of your day.